Allergic reactions. So what is an allergic reaction? Well, it's triggered by some sort of allergen. So if somebody's allergic to something, there's some kind of trigger that causes that. Triggers can be like everything. It can be certain foods, medications, whether that could be, a medication that somebody takes like a pill or an injection, like a vaccination or something. It can be things in the air like dust, pollen, mold, pet dander, those kind of things. Or it could be something like a bee sting or a snake bite or some kind of, bite or sting from some sort of animal. When somebody is exposed to something they're allergic to, their body releases histamines to kind of attack this allergen, basically to get it out of their body. And this process can cause various symptoms. Commonly, the symptoms will kind of vary based on how they were exposed to the allergen. So, for example, if it's something they ingested, if they eat something they're allergic to, they're most likely to get abdominal symptoms, vomiting, diarrhea, those kind of things. If it's something they inhaled, like you get pollen in your face and you breathe it in, you're probably going to have sneezing, watery eyes, runny nose, maybe a cough. If the allergen's injected, like a bee sting, probably going to have pain and itching at the site of where the bee sting happened. Maybe a little bit of a rash around there, but probably kind of swelling and itching and stinging at the site of the sting. If it's something that contacted the skin, like maybe you used a new laundry detergent and you're allergic to it, you'll probably have again that baby pain or itching or possibly a rash, maybe some hives. And really, those are kind of specific to the way that you're exposed to the allergen. But with all allergens that you're exposed to, you can have any combination of these symptoms. So you might have, most commonly we see those rash, the hives covering the whole body. So itching, swelling, those kind of things. Now, if it's a severe allergic reaction, that's a little bit different. It actually causes anaphylaxis. And that's what we're going to learn more about today because these, itchy eyes, watery eyes, runny nose, those are, uncomfortable, but they're not a medical emergency. Medical emergency is when it becomes anaphylaxis. So anaphylaxis, again, is that severe allergic reaction, and it causes systemic effects, meaning it affects the whole body. So widespread hives. So maybe they got stung by a bee in the arm, but they actually have hives all over their abdomen and back. That tells me, oh, this is looking like anaphylaxis. If you put on a t-shirt that has laundry detergent that you're allergic to and you get a rash under the shirt, that's not as big of a concern. But if you got stung in the arm and now you have hives all over your abdomen and back, that's a lot more concerning because that tells me it's not just at the place where you were exposed, but it's systemic. It's going through the whole body. They'll commonly also have a sense of impending doom. Maybe it'll start as just anxious, they'll be anxious and kind of restless. And then as it progresses, they'll tell you, I feel like I'm going to die. They'll have that sense of impending doom. And then the two big systemic effects that make this life-threatening are the difficulty breathing and the lowered blood pressure. And that's because the bronchioles constrict, which is, the bronchioles are the pipes that we breathe through. So that's going to make it really hard to breathe. You're going to hear a lot of wheezing. And then that lowered blood pressure is going to happen because of vasodilation. When your body has too much histamine, the blood vessels dilate, and that's going to cause the blood pressure to drop. So we have that blood pressure dropping, really difficulty breathing. Sometimes they'll tell you it feels like their throat's closing off, their chest is tight, but they just kind of feel like they can't move air. We start to see these systemic effects within 30 minutes of being exposed to the allergen. It's going to depend on the person, how much of the allergen they're exposed to, how they were exposed, whether it was something they ate or something they were injected with. But within 30 minutes is when we'll start to see anaphylaxis develop. If you've had a vaccination, they'll have you sit in the waiting room for about 30 minutes. That's why, because that's about how long it takes for you to have that allergic reaction to develop at the most amount of time. Sometimes it's instant. What causes all this, again, is your body just releases too much histamine. So you have an overabundance of histamines going through your body, and they cause all of these symptoms, which can be deadly. Because if you can't breathe and your blood pressure bottoms out, that's kind of a problem. So to treat anaphylaxis, as you probably know, we use an epinephrine auto-injector, sometimes called an EpiPen. EpiPen is a brand of epinephrine auto-injector. That's the most common. But before you give the auto-injector, you want to check the 6 rights. Make sure it's prescribed to that actual patient. If you're giving, if you're, working as an EMT, you can't give one person's medication to somebody else, as you know. So if it's prescribed, you want to make sure it's prescribed to them. If it's something that you're carrying and you're giving to them, as long as that's allowed with medical control, that's fine. Make sure you're giving it the correct route. An auto-injector is going to be intramuscular, so it's going to go into the thigh. Make sure it's the right dose. Adult EpiPens are typically 0.3 milligrams and pediatrics are 0.15 milligrams, half as much. Make sure it's the right medication. If you can see the medication in the EpiPen, look and see if it looks clear. If it looks like it's milky or anything like that, that's not good. Make sure that it's not expired. Look for that expiration date. And make sure that you have the right documentation. Document the patient's full set of vitals before you give the EpiPen. Document how they respond to it. Recheck their vitals 5 minutes after you give it. Have all that documented. And make sure you document that you did check the 6 rights, who it was prescribed to, the dosage, all that. And then make sure you have permission from medical control. So after you go through the 6 rights and it seems right, make sure you have permission. That might mean that you need to call medical control if you have online medical control orders to give EpiPens or assist with EpiPens. Or if you have offline standing orders, that would be permission from medical control. But just make sure it's within your scope of practice and that it's allowed. It's going to vary from place to place whether you can give somebody an EpiPen. Some places you may be able to carry your own and deliver it. Other places you may only be able to assist the patient with their own EpiPen. If that's the case, that needs to be prescribed to them and it needs to be their own EpiPen. Once you've determined, you check the 6 rights and you've determined you're allowed to give or assist with that EpiPen, that's when you're going to deliver it. So you'll hold the device, make sure your thumb is not over either one of the ends. Hold it like a kindergartner holding a crayon with your thumb wrapped around so that it's not poking over the end. That way, if you accidentally have the EpiPen upside down, you won't get injected. Now, typically, every auto-injector that I've seen, there's some sort of safety. You have to pull that safety off before you're able to give the injector. With the typical EpiPens, that'll be that blue end. It just kind of pulls off. That's your safety. You'll pull that off before you deliver it. And then you'll press the other end into the thigh. Now, you want to go against the lateral thigh. You want to find the thickest part of the thigh muscle, and you're going to push that injector into the thigh. When you do, you'll hear a click or feel a click. That is the needle dispensing into the leg. And then you want to hold it in place. And you can see here, I've said 3 or 10 seconds. That's going to depend on which auto-injector you're using. They used to say 10 seconds, but if the patient wiggled around, a lot of people were breaking the needle off in their leg. It's a really big needle. It's made to go right through their clothing and everything. So when you're giving this, you don't have to remove clothing. You can go right through their pants. But it caused that needle to be broken off in a lot of people. So a lot of the companies lowered it to 3 seconds, and they said that's enough time to dispense the medication. So look on the side of the EpiPen and see what the instructions say, and I would just go with that because they're going to vary based on the brand. Also, make sure that somebody is stabilizing the patient's leg while you give the EpiPen. So you can either have your partner hold the leg down, or you can sit across from the patient and use your 2 knees to pinch the patient's leg between your 2 legs. So you're holding their leg from moving, but you don't want them to move around and break that needle off. So just make sure you're somehow securing their leg before you give it. Okay, the effects of epinephrine. As a side note, if you're following along with all these videos, you know I love to make comments on the PowerPoint designer slides they come up with here. I guess I don't even see anywhere where I use the word direction or anything, but they came up with this compass picture. It kind of looks like a clock. So I thought that was good because you'll see where we're going to talk about some timing and watching the clock is going to be important. So it's not a clock, but it looks like one. So we'll go with that. So what are the effects of epinephrine? Well, most important for you to note is that it does not fix the problem. Remember, the problem for what's causing anaphylaxis is an overabundance of histamines. It does nothing to take care of the histamines. So it's not going to actually fix the problem. It is, however, going to correct the symptoms. Remember, the most life-threatening symptoms of anaphylaxis are bronchoconstriction and vasodilation. The bronchioles get small so they can't breathe. The blood vessels dilate so the blood pressure drops. Well, just so happens epinephrine is a bronchodilator, meaning it opens up the bronchioles to make it easier to breathe. And it's a vasoconstrictor, meaning it constricts the blood vessels or makes them smaller to help raise up the blood pressure. So you will see when you give this, you'll see an increase in the pulse, an increase in the blood pressure. It'll get easier for the patient to breathe. It's buying you time for transport. It's not a solution to the problem. It's just going to buy you time. That epinephrine is going to wear off somewhere between 10 and 45 minutes from when you give it. Most likely around that 20-minute range, you're going to start to see those effects wear off. If the histamines are still in that person, or excuse me, if the allergen is still in that person's system, the body is going to continue to release histamines and they're going to go right back into anaphylaxis. So transport, rendezvous with ALS, especially if you don't have more EpiPens to give that patient. If ALS is closer than the hospital, I would rendezvous with ALS, because when that first EpiPen wears off, you may need to get permission to deliver a second or even a third EpiPen to get them to the hospital. So that's all I have for anaphylaxis and allergic reactions. Thank you.